It was just really difficult, and there was no support and no understanding of this disease. Even my family, I don't think, really understood the seriousness of the disease until I couldn't walk anymore, until I had so much joint damage done that they had to know something really bad was happening.
For a while they were thinking it was an allergy of some sort. I was at a point where some of the numbers of the counts of different parts of my blood were at a lethal level. So when they finally discovered what it was, I was rushed to the hospital.
I went from being an Olympic caliber athlete, leading what I considered a very healthy life and lifestyle, to being wheelchair bound in about a month.
Ça change une vie d'une façon terrible, en ce sens que qu'est-ce que je vais faire demain? Est-ce que je me ramasse en fauteuil roulant? Comment je vais faire pour faire vivre les enfants, faire vivre la famille? Est-ce que j'ai les moyens financiers de continuer? Est-ce que? Et il n'y a pas de réponse pour rien.
I'm retiring soon. I have plans. And suddenly, I don't know what any of that is going to look like. I feel like my body has let me down. I can't predict what will happen. And there just is that sense for me right now that even little things like, well, I might want to go for a walk. I might want to go for a walk in a park, and then right away I think, oh yeah, but what if something happened? I couldn't get to my car, So, I mean, it's just sort of, it's there, and it hurts.
Arthritis represents really over 100 different conditions, so that's arthritis and other bone and joint conditions. It can affect any age, that babies can get arthritis and people who are 100 can develop arthritis. So it crosses the spectrum of age. It can affect men and women. It can affect people of all races and creeds. The Alliance is a collection of over 30 stakeholders, from people living with arthritis, healthcare professionals, researchers, governments, corporations are all involved in this, and collectively we can make a difference.
C'est la première fois que toutes les associations de l'arthrite sont ensemble. C'est quand même une étape très importante et très significative que maintenant il y a une seule voix pour l'arthrite.
Success for the Arthritis Alliance is really about delivering on the strategic framework that we launched in September of 2012, where we articulated 3 fundamental priorities for action. The first is raising awareness of arthritis and dispelling the myths that nothing can be done. The second is about improving delivery of care for people living with arthritis by creating innovative models of care and really making sure that we adopt a patient-centered approach to the treatment of arthritis. And the third is really about strengthening and enhancing our research capacity in Canada to focus on really finding ways to make it better for people living with arthritis in terms of the research focus being a patient-centered focus.
And I think that most people at the public level, when they hear the word arthritis, have no idea that there are all these different types, like rheumatoid arthritis, that are as impactful on one's life as cancer, as HIV.
Because arthritis is so common, and arthritis is something that is developing over years and then manifesting over years, it really it isn't perceived as an important problem in society. But we know that that's absolutely not true, and that's what the research that has been done to date shows us, is that it significantly impacts people's function, it has significant economic impacts, it affects people's productivity at work and their role in society.
Because I see primarily patients with inflammatory joint disease, inflammatory arthritis like rheumatoid arthritis, there's been a huge change in the therapies available for these patients. So it's actually been, my career has changed dramatically in the past 10 years because of these new, very effective therapies. The people are doing really well. No longer we have hospital beds full of patients with inflammatory joint disease that can't move.
For 20 years that I was in practice, we have very little to offer to our patients. I felt like somebody walking in the desert without any water. And so in the last 10 to 15 years, we've had new drugs. And the new drugs have been studied before market, but not so much after market. And I think it's very important to see how the drugs work Are they as effective as in the trials that were done before marketing? And are they as safe? And the reason for that is that our patients are getting older, and the Alliance has shown in the Impact of Arthritis report that the number of patients is going to double over the next 30 years.
The damage I've had, it started in my left ankle and my right elbow were the two joints that were affected the first. It very quickly progressed and started I almost saw it as this thing that was attacking each joint in my body. Eventually, every joint in my body was affected by RA except for one ankle and one hip. So very quickly after that, I had both knees replaced. I had an ankle fusion. I had both shoulders replaced, an elbow replaced, both wrists fused, and cervical fusion in my neck. So I set off the security at the airport pretty well when I go through. Every joint surgery was very successful. It relieved the pain, and so then I started with the upper body surgeries and then regained a lot of the use of my upper body, which was more challenging than the lower body. And a couple years ago we picked up kayaking, and that's kind of helped as well to rebuild some of the strength because your muscles waste away when you don't use them. So it's a lot of work to rebuild.
La médication que je prends maintenant, c'est un agent biologique. Depuis 12 ans, je prends le même agent biologique et je suis bien contrôlé depuis 12 ans. Avant ça, ça a été par essai-erreur. Faut pas oublier que la méthode de traiter les patients a dramatiquement changé ou ça a évolué avec le temps. Moi, ça fait 27 ans que je suis atteint d'arthrite. Donc, au début, c'était essai-erreur. Et si ça ne fonctionnait pas, on ajustait les doses jusqu'à la dose maximum. On changeait le médicament. On essayait une autre chose, un petit peu d'autre chose. On rajoutait un peu de quelque chose. Fait que finalement, typiquement, j'ai commencé avec des anti-inflammatoires. J'ai eu après ça des périodes avec de la cortisone. Finalement, après 8 ou 9 ans de maladie, j'ai commencé les agents de rémission qui sont préconisés aujourd'hui dès le départ, qui s'appellent les antirhumatismaux, comme le méthotrexate. J'ai commencé ça 8-9 ans après le début de ma maladie. Et aujourd'hui, ce que je prends, c'est des anti-inflammatoires. Je prends du méthotrexate et un agent biologique, et ça fonctionne à merveille.
The advent of biologics was huge. 12 hours after I took my first dose of that type of medicine, which is sort of the newest type of medicines to treat my disease, 12 hours later, my husband and I interlaced our hands together for the first time in our married life, which sounds really kind of corny or simple to a lot of people, but you have no idea what that feels like. It's incredible.
Speaking with one voice, no matter where you are in the arthritis community, can only lead to better results. And so I thought if the Arthritis Alliance is really coming together in common cause with this strategic framework, then we should join voice and join forces with all of the other players in the arthritis community so that we can really make a difference at the end of the day in the lives of those living with arthritis.
As a patient, one of the things that I learned early on is that the squeaky wheel gets the grease in the healthcare system. People with arthritis, there are 4.6 million of us in this country today, and we need to unite to advocate on behalf of ourselves, but on behalf of our entire community of 4.6 million. It's so important that we talk to our friends and neighbors about our disease, because only then will others around us in those broader sort of concentric rings, like employers, like government, only will they learn if people like me exercise our right to speak out about what's affecting us in terms of our health and arthritis.